Hi viewers, this is Dr. Rajinikantha and we are going to touch upon a very important topic. People who have diabetes and blood pressure, it is very important that they have their eyes checked up once in 6 months' time, because the diabetes can affect the retina of the eye, what is known as diabetic retinopathy. There are various stages in that. It's an early stage is known as pre-proliferative diabetic retinopathy. Some people call it background diabetic retinopathy. And the later stage is we call that proliferative diabetic retinopathy. So it is very important that we catch this problem early so that we are able to treat it. There is a retinal laser treatment available. Sometimes we give into the eye some injection to bring down the fluid in the retina. So depending on the stage of retinopathy, we can do. In early retinopathy, we do this retinal laser. In a very advanced type of proliferative diabetic retinopathy, we do vitrectomy, where sometimes there is hemorrhage inside the eye. Then we remove all the blood inside the eye. We remove all the unnecessary tissues which are proliferated. And then we restore the vision of the person. But it's very important that every diabetic comes every 6 months for a checkup so that we are able to pick up any of these in the early stages so that it's easy for us to treat. And also that even if there's no symptom, please do visit your eye specialist every 6 months. And also blood pressure patient, it also can affect the retina, known as hypertensive retinopathy. The arteries become very narrow, the retinal arteries, and sometimes the veins undergo blockage, what is known as branch retinal vein occlusion, sometimes a central retinal vein occlusion. So all these things can take place in a hypertensive patient. So it's extremely important that all people with high blood pressure also have an eye examination done every 6 months, and we check the retina, evaluate the retina, and then if it's needed, if it's normal, we just tell them everything's fine, you come after 6 months. But if it is not, if there are some changes of this thing, there are suitable treatment available for any stage of retinopathy, we can treat them. But it's extremely important that people with thyroid problem, with the high blood pressure, with the diabetes, all these people, they come every 6 months, visit their ophthalmologist every 6 months to evaluate the retina and the rest of the eye. And we will completely check up the eye and then tell what is important and what should be done and how to prevent this thing. Of course, they should take medications advised by their physician, salt-restricted diet, sugar-restricted diet, diet control, and all the medications. Whatever the physician has prescribed, please follow those medications also and have an eye checkup once in 6 months. Hope this was useful to you. Thank you so much.